Well, good evening, everybody. My name's Randy, Chief Technology Officer of VDI Laboratory. I'm so glad you could join us this evening. This is a live event. Um, Sometimes these things aren't, they're recorded, but this happens to be a live event, which means you can ask questions, which is why I'm bringing it up. At the bottom of your screen, there's a little Q&A box. At any time during this event, you can ask a question. We'll either answer it immediately if it's relevant only to you, or we may queue it up at the end. But tonight, I think I'm quite excited to talk about tonight because we're here to talk about degenerative joint disease. And when I think about, the cases that you see, I mean, what are the big cases that your clinic sees? Gastrointestinal disorders, atopic dermatitis, degenerative joint disease. These are probably the big one, two, three. I don't know which order they happen to be come in. And by the way, we have great solutions for all of those. But degenerative joint disease affects a lot of patients. Specifically in dogs, it affects 18 million dogs, about 20% of all adult dogs, up to 90% of those over 8 years old. It's not just osteoarthritis that we're talking about tonight, but also immune-mediated polyarthritis, IVDD, which is pretty relevant in certain breeds. But overall, about 30 to 50% of all dogs over the age of 7 are going to come down with some form of degenerative joint disease. And it also affects cats. You may not see as many cats in your practice for this, just because, I don't know, people just don't bring cats in for the same reasons that they do with dogs. But I think the bigger reason might be because cats are so good at hiding their clinical signs. But the reality is that 60% of cats over the age of 6 and 90% of the cats over the age of 12 actually have degenerative joint disease. And it's an equal number to dogs. So it's not like cats don't have this problem. They actually do. And it's something that we need to be cognizant of and maybe help educate pet parents more about it and be more proactive in this particular area. Now, when we look at a healthy joint, of course, what are we talking about here? We've got chondrocytes and synoviocytes that produce synovial fluid. Synovial fluid is the magic that's actually making everything happen here. There's a nice capsule, or basically a balloon, that holds everything intact. And synovial fluid is providing all the lubrication and the shock absorbent effect, which is mostly coming from HA, or hyaluronic acid. It increases viscosity, it's hydrophilic, and it is certainly going to be the main modality here. But when we have degenerative joint disease, as the name kind of implies, it is a progressive disease. We end up with localized inflammation. The capsule begins to degenerate or begins to increase permeability, and then it literally leaks synovial fluid. I mean, that's about as basic as it gets. Synovial fluid basically comes from inside the capsule into the bloodstream and into the surrounding tissues, reducing joint lubrication. We cause then mechanical stress. And now we end up with, in these more advanced cases, which certainly you've seen lots of them, you end up with cell death because the bones are pounding against each other. And now we're literally killing the cells that make synovial fluid. So at some point, there's literally no more synovial fluid. I mean, that's kind of what happens. And when we work these patients up, of course, it's the pet parents. That's the first, line of defense. They're the ones that are seeing the pet, either acting weird, walking weird, doing something that's a little bit abnormal. They bring it to the attention of the veterinarian. You get an exam. You may look at gait. You may look at range of motion. Depending upon the stage, you may be doing radiographs. And radiographs are important, but tend to only identify things that are more moderate to late stage. They may not be able to identify them more earlier. We can certainly do more advanced diagnostics, such as force plate, MRI, synovial fluid analysis. But the reality, at the end of the day, there is a standard and there's a cost. Many pet parents may not be able to afford all of the things that we might want to do, in which case then we're having to truncate this list a little bit and then take some level of action to accommodate whatever might be going on clinically with this patient. So the point of tonight's webinar, I guess, is to introduce you to a novel biomarker, which is serum hyaluronic acid. All right, so is really the basis of the test is really quite simple. We've got the capsule, we've got HA in it. As the degeneration occurs, it begins to leak out. As it gets worse, more and more of it goes above our threshold, and that threshold then is related to a problem or a degenerative joint disease. And why will this test even work? Well, I like to sort of look at the differential between the concentration of HA in the capsule and the concentration in the serum. Now, there's about 3 milligrams per milliliter of hyaluronic acid within the capsule that's providing all this wonderful effect. And in our cutoff in this particular test is 20 nanograms per mil, which means that if you do the math, it's about 10,000 times difference between the two, about a 4-fold difference, which is actually quite huge. And when serum HA goes into the bloodstream, it has an incredibly short half-life. It is only 5 minutes. Yes, that's right. 5 minutes. That means probably like, what, 15 minutes or something? It's gone. I mean, so whatever you're measuring at that moment in time just got excreted not that long ago. It's that fast. And if we look at the box and whiskers plot, you can see that we get good separation from healthy controls versus degenerative myopathy, OA. It would also be inclusive of IVDD, IMPA, because they're all going to be kind of similar in this regard. And that is why it works as well as it does. Now, to look at the story a little bit more closely, when we have a leaking capsule, it's not just an on-off situation. It starts off slow and it begins to rise. Now, most of the time, as long as synovial fluid production is equal to synovial fluid leakage, honestly, I don't think you're going to see a thing because the joint is still full of synovial fluid, all right? But there's going to be a point when that begins to be changed. And you're going to see these levels rise in sort of the occult stages. This is like early detection or mild, which may still not be noticeable. But at some point, it's going to go up and literally come back down. Because as this disease advances and we end up with bone-to-bone contact, we're going to end up with cell death. Chondrocytes and synoviocytes are actually going to begin to die in these more advancing stages. And you'll actually see it go up and go down. There's a similar kind of situation that we see in a disease that I think you're fairly familiar with, obviously familiar with, which is like pancreatitis. So you've got the SNR cells that actually are producing it. You get necrosis of them because they can't eject it. They're dying from their own enzymes. And so we see pancreatic lipase go up. At some point, if you get enough of them dying, they're no longer making it. And you end up in a situation where you end up with pancreatic insufficiency. And so that's why you can have like weakly positive in really occult stages, and you can have weakly positive in very advanced stages. And you know, the only way you're going to know is from clinical status or maybe imaging that actually is going to be able to tell you. And so a similar modality exists because the cells that are producing it go away. Now, as disease progresses and we bring in the inflammatory piece, this is an inflammatory modality. I mean, there is localized inflammation for sure. That's why NSAIDs, for example, can be effective in certain ways. They just can't be used long-term typically. But since we're measuring CRP, or in case cats would be haptoglobin, it is diluted by the peripheral blood. And so it takes a certain amount before it actually begins to register. And so we're not going to see inflammation until it actually begins to get into sort of the more moderate stages and late stages, in which case then we may be at a situation where we begin seeing cell death, and hence intervention might be somewhat compromised because we want to try to intervene early, not late. And so when we look at a sort of a differential of the diseases and inflammation, we can certainly, obviously normal is normal in both cases. Osteoarthritis is going to be elevated. It may be no inflammation early on and moderate, slightly elevated in later stages. Now, immune-mediated polyarthritis is going to be elevated like OA, but now CRP is actually going to be quite elevated. And anytime you've got any kind of autoimmune disorder, like IMPA is, it's going to have a very strong immune modulating, or CRP is going to actually be very quite high. And so it can actually be a useful point in a differential in helping you decide what's going on. A degenerative myopathy is going to be similar to OA as well as IVDD. And then we've got acute joint injury. Well, anytime you have an injury, you're going to have high levels of inflammation, but it's pretty easy to see that the patient's got an injury. So that's not much of a differential there. So point is that inflammation can help guide you, and depending upon where the patient happens to be at and with the type of diseases that they have. Now, certain treatments are going to also affect certain things. Now, when we look at the different types of treatments, and this is not an exhaustive list, but certainly things that you're familiar with, like NSAIDs, Adequan, stem cells, platelets, plasma, oral HA like Trixin, and monoclonal antibodies like Librela. Some of them promote synovial fluid production, and some of them don't. NSAIDs have no effect, zero. Adequan does a good job. So does stem cells. So does platelet-rich plasma. So does oral HA. Monoclonal antibodies, nada. Doesn't do a thing. As far as inflammation goes, you're going to see that, of course, NSAIDs does a very good job. It's going to also decrease inflammation, as well as all these other modalities. Again, monoclonal antibodies, nothing. Now, when you're treating these patients, it's best to treat them best to try to catch it early. And when we treat it, depending upon capsule permeability and whether we're impacting capsule permeability or not, post-treatment, since we're actually stimulating more synovial fluid production, we may see, if there's no change in permeability, an increase. So, for example, if the patient's put on Adequan, but there's actually no change in the permeability, we may actually see it go up. The patient might be clinically doing better, but the reality is that that's because it's making more synovial fluid, but the HA value may actually be elevated. Now, but if we're actually positively impacting capsule permeability, which is certainly in some of these regenerative type therapies, then what we're going to see is the capsule reducing that level of permeability and actually beginning to contain the leakage, and it may actually then come down. And so these are different modalities and different expectations that might occur depending upon how that treatment is affecting that particular patient. This is a little bit busier slide, so I'm not going to go through each one of them because it'll take too long. But the point here is green means that it's good and red means that it's bad. So when we look at synovial fluid production, we can certainly see that with Adequan and Trixin, it's certainly going to be increasing it. Certainly they have anti-inflammatory effects, and they do, to some extent, have some kind of pain reduction modality, maybe not a direct pain receptor elimination, but through increased mobility, you end up then with some level of pain reduction that's occurring. NSAIDs and like Librela are going to actually be reducing the actual pain receptors. Librela, for example, is very, very strong. There's recently some FDA warning that's come out about it. I don't really know enough of it, but the point is that I think these products have to be evaluated accordingly. Now, when we look at kind of in practice, which I think is really at the, and this is going to get talked a lot more by Dr. Greear, but I think in practice, we think about what are our goals. Obviously, catch it early. I mean, I don't care what disease we're talking about. At the end of the day, the earlier you catch something, the more chances you have to deal with it in an appropriate manner. Second step is stimulate synovial fluid production. I mean, just dealing with pain, if all you did is sort of knock the pain out, they may actually do more damage because they're not feeling it and they're just going to cause it, rip it up, Point is you got to get more synovial fluid production that's occurring, and then pain management is needed. So if we sort of break these patients up into those with clinical signs and with those without, obviously those without, if the HA is negative, schedule them for the next annual examination and testing. Those that are positive, things like Trixin with oral HA could be very helpful, managing weight, getting it off. These are very easy things to deal with. When we have those that are showing clinical signs, they're either going to be sort of earlier to moderate stage or a late stage, which is going to be indicated to you based upon not only clinical signs, but also HA values. And so if you've got serum HA values that are elevated, what does that tell you? It tells you that the joint is still making synovial fluid. It might be high, but they're there, they're busy, they're alive. If you've got a dog that can barely walk and HA is just weakly positive, that is telling you that the cells are basically they're gone. I mean, they've given up. And so depending upon where we're at, you would either like in sort of early moderate stages, we would stimulate synovial for production. manage inflammation, manage pain. This is where I think regenerative therapy would certainly be a very, very appropriate. And then in later stage, I'm not certain how much we can actually do here other than quality of life and managing pain. This will certainly be an area where products like Librela have a very strong place to hold. But ideally, try to move this thing closer to the early stages. Now, I know this group loves vitamin D. Anybody who knows me, I'm like a vitamin D nut. But we did this study, and we happened to throw vitamin D in it. So we were looking at HA, and this happened to be a group of apparently healthy dogs, and we were just sort of measuring things. And we found this correlation, which I think is really, this is early data, so I'll be careful as to what I actually claim here, but I just wanted to share it because I think it's kind of interesting. And if any of you have, any level of appreciation for vitamin D, I think it's going to click pretty fast. Here is that when we have low levels, deficient levels of vitamin D, we can see that HA values are actually quite elevated. And then when they get to past a certain threshold, you can see it drops very fast. Now, the p-value is 0.037, which means it's clinically significant, and an N of only 32 cases. Now, I've done enough of these vitamin D studies to know a lot of times you got to get up to like 400 cases before you reach significant p-values. So this is actually pretty kind of exciting. We're going to be taking this beyond this to kind of figure this whole thing out. But I think it has a lot to do with vitamin D's anti-inflammatory modality. We know that degenerative joint disease has a localized inflammatory modality to it. And maybe early on in this disease status is that it's actually, when you have low vitamin D, that you're ending up creating more localized inflammation in certain active joints, and then leading to the permeability, the decrease of synovial fluid, and then the problem just begins. Anyway, it was interesting. So I always have to tell people, when not to test. There are certain situations. I told you the liver just chews this thing up like there's no tomorrow. So if you have really severe liver disease, I mean, that's probably what you're focused on and not degenerative joint disease, but don't be surprised that if you have really severe liver disease to see elevated HA values. The other is that HA is part of the ECM, which means that if you've got a growing patient that's got wound repair, anything where you've got tissue generating kinds of activities, don't be testing. So basically under 2 years of age, it's not appropriate. And this is really not a test for a really, really young animal anyway. This is meant for like, more like 5 and above. But I just want to be clear on that. Then the opposite side of this equation is when to test. Well, certainly healthy animals over the age of 5. Certainly, I have a Great Dane, so perfect one for that. Agility dogs, animals that are predisposed to it, like Australian shepherds, suspected, confirmed degenerative joint disease, such as behavior changes. Have pet parents pay attention to cats, particularly because if they start seeing them acting any little bit weird or something like that, it could be that something's going on. Sporting dogs, and certainly patient monitoring as well. So now I think I'm going to have Dr. Greear join us. I'm pleased to welcome Dr. Lucretia Greear. She's a longstanding client of VDI, and she's very passionate and proactive in the area of joint health. She brings a comprehensive and integrative approach to patient care with certifications in acupuncture, hyperbaric oxygen therapy, regenerative medicine. She's got some cases on regenerative medicine. And she currently serves on the Michigan Board of Veterinary Medicine, which I think is a pretty big deal. Her clinical philosophy centers around being proactive and not reactive, and leveraging markers like HA as early indicators of joint disease to guide early interventions and optimize outcomes in her patient. And I'm very pleased that you are here tonight, and I'll let you take it away.
Yes, thank you. Thank you so much. And I think just beautiful. It was wonderful to kind of see that, see the presentation and just help explain this. I just think that this work is so valuable for veterinarians and can really, really change and elevate our level of care and our standard of care. And I'm so grateful to be a part of it. So thank you so much. And thank you for the opportunity. So My name again is Dr. Greer, owner of Woodhaven Animal Hospital, and we are an integrative veterinary hospital. And I have worked with VDI as long as I have been doing integrative medicine. I think easily 10 plus years, maybe longer, at multiple practices. I have just really been fortunate to learn about these different markers and just the different testing modalities that VDI has to offer. And I have been fortunate to be able to use these things in practice and have really been able to see the value that it can bring to patient care and kind of what we can do. So I'm excited to share this and excited to share some cases. So we can go ahead and get started. All right. So he mentioned Australian Shepherd, and this is definitely this is an agility dog, 6 years old. This dog's Jovi. The owner made an appointment with us because she noticed that during an agility training session that Jovi hesitated to go over the A-frame, and this dog is a bolt of lightning when it comes to an agility course. And there's no hesitation or no resistance to any obstacle ever. And so she wanted to come in and make an appointment, and because of how we practice, this was something I think she just was worried about arthritis. She knows the dog is very active, and she just wanted to know, is anything happening? Am I doing anything to hurt the dog? Is there any issues that I need to be aware of? So we did some exam, a physical exam, and saw that there was a little bit of maybe discomfort or warmth on the shoulder region. We did full body x-rays. The owner wanted to see everything. And honestly, looking at the x-rays, there was really nothing significant. The articular structures, the hips, the knees, the shoulder joints, everything from an orthopedic standpoint appeared to be normal, so there were really no significant findings there. So then we have infrared imaging. So those pictures below show us using an infrared imaging system to basically look for abnormal heat distribution. Sometimes when we aren't able to visualize changes on X-ray, we can use infrared imaging to basically show us and possibly locate where is there a problem, or is there a problem? Is there more heat concentrated in an area? Sometimes this tool is more sensitive than what we can see with X-rays, and at least hone you into a specific area. So our thermal imaging with Jovi didn't show a whole lot either, even though I kind of thought maybe in the shoulder region there might be a little bit of heat. So I talked to the owner about VDI testing and the whole idea of using HA as an indicator to look for degenerative joint disease. And I explained to her he's very active. He's been doing this agility work, and that if there is a possibility that there are degenerative joint changes happening, the sooner we intervene and start doing things, the better. So she was excited about the test. She was very eager to do this, and just a lot of owners are very interested. Is there any blood tests or anything, any markers that we can look at that can give us this information? So here's our test on Jovi, and as you can see here, we had done a test on Jovi prior. Jovi, because of the agility, we had done a screening on this dog before, just to kind of have baseline levels. She wanted to do this. It was, I think, a year, almost a year or so prior. So we did have previous numbers, and we knew that HA levels were good before. So, and we were specifically wanting to look at this. This is the osteoarthritis panel. It includes, this is actually the 104 panel, I believe. It has vitamin D and the CRP, that systemic inflammatory marker, and obviously HA. So when we ran this test, we got a positive on that HA marker. And again, this was, clinically, there was no real pain, no gait abnormalities, but she noticed this sort of hesitation, in during an exercise. And once basically we took this information and I explained to the owner concern for degenerative joint disease, and we need to do something here. We followed the recommendations and started using Trixin, the oral hyaluronic acid supplementation. Um, she waited about I think 10 days, 2 weeks before she took him back to exercise, just to get that HA in the system. We basically focused primarily on joint support. But the owner reported 2 weeks after using the Trixin that Jovi was ready and able to start taking these challenges again. I do have her scheduled to check again this year, so I'll be getting a new osteoarthritis panel on Jovi just to kind of see where he is. But this was a beautiful case because I think it showed that one, we did the x-rays, we did, thermal imaging even, and didn't really find anything. Had I not known about this and done this test, I wouldn't have been able to start to make any changes to start to um, prevent and intervene with degenerative joint disease. And I feel like in veterinary medicine, this is our goal. We're trying to find these things early and address them early. And the sooner the better. So she was very pleased. The dog is still taking Trixin, and we're focusing primarily on joint support and joint health. The dog is still very active, and now we've implemented this osteoarthritis screening as a part of our wellness care for Jovi. So he's doing very well, and this was just a neat case. It wasn't a huge change in HA, but um, he really wasn't showing a lot of clinical symptoms or physical exam changes. So, but this dog definitely improved from us having this information. So that was Jovi. So we can go on to our next case. And obviously, Andy mentioned cats. Cats can be very complex. They are secret keepers. They don't tell the truth ever. And most of the time, and every veterinarian who has worked with cats, by the time we are able to diagnose problems, it's generally too late. And that is true regardless of if we're talking about osteoarthritis or some other internal disease. When cats are showing symptoms, generally we're well advanced into a medical problem. And I don't think any of us practicing out there are going to disagree with that. So with cats, this is a very, very valuable tool. I feel like cats are absolutely underdiagnosed with this, and there are absolutely more incidences of degenerative joint disease in cats than what we even realize. So we can absolutely do a better job managing this disease process in our feline patients. So this is Kai. Kai is a very special, interesting kitty. He has had some immune issues since he was a kitten. He was kind of an inbred rescue situation, and the owner has just really gone above and beyond to just manage his quirky behavior and his health issues. He is one of the few cats that I've managed that has luxating patellas. They're bilateral luxating patellas. His patellas generally they move often and move a lot. They would prefer to kind of stay out, I think. And he's kind of learned, almost like those small breed toy dogs that kind of just get used to and acclimated to having this luxation and really don't seem to show pain or any um, clinical symptoms or problems with it. They just kind of readjust and put the kneecap back in and they carry on. So this was Kai. So examination with Kai, and we realized that his patellas luxated so easily. I thought, you know what? Let's look at his an osteoarthritis panel on Kai and see what we find. His X-rays, not a lot of bony change or osteoarthritic changes on the X-rays, but there is absolutely laxity in the patellas bilateral. And so again, those were the X-rays that we did with him. But we also ran this VDI. We did a pre-stem cell panel because of his other immune issues that he had. And so I kind of was very interested in vitamin D for him because of the immune component and the very important role that I believe vitamin D plays in immune health. Um, But we ran his initial panel, and you can see here, this was a lot of information. There was a lot of red. That haptoglobin marker was up a little bit. We had this neoplasia index on this test, and I'm going to focus primarily on the HA here because this got into a lot more, and there were reasons that we did this. But we were looking at TK, a proliferative marker for sometimes cancerous processes or abnormal proliferation cell marker, the haptoglobin and that HA, and that number was up there pretty good. So this chronic luxating patella cat that really seems to have no symptoms or real problems. He is a grumpy, kind of a very interesting attitude cat. So I was concerned that maybe some of this degenerative joint change that he was having here is playing a role in some of the behavior with him. But also with Kai, this history of immune mediated disease, his vitamin D, that was 36, and that was low. When we are kind of in that red zone, I believe very, very strongly that D plays a really important role in immune health, and we know it plays a role in bone health. And so for Kai, I think I felt like, seeing this information and correcting both the vitamin D and addressing that HA or degenerative joint disease was going to be really important and really helpful and improve his quality of health. So this was our sort of a treatment plan. We started him on vitamin D supplementation, and I stay pretty close with the guidelines. When you run a vitamin D test or these tests through VDI, you're not just given the information, you're given some guidance with it, and I think that that's very useful, and it's very, very helpful, and it gives you a good starting point and a plan to sort of monitor moving forward. So we stayed within the guidelines and we followed the vitamin D recommendations. I use the RX vitamins that suggested and recommended. We know the absorption of these products, and there's documented information on it being able to truly improve animals being able to absorb vitamin D in these forms. So we started on the vitamin D. We gave Regeniflex, which is a exosome stem cell therapy product. So it's an injectable regenerative medicine product that we can give. There is no live cell with Regeniflex. But it essentially can mimic sort of a stem cell transplant without us harvesting cells. And we did this because of the DJD, how high that HA level was. And, like Randy discussed earlier, when we have this inflammatory marker increased as well as this HA level and the D deficiency, I know that if I could do an MRI or CT scan, I am going to see some negative degenerative changes in that joint. That synovial lining is damaged. We're definitely, killing. There's some cell death involved, and there's an inflammatory process here that can absolutely lead to worse and worse change for him. So we went with the regenerative medicine option. It's a single injection. It was done once, and Silencia, which the monoclonal antibody to just help with pain. And we did several Silencia boosters. I want to show you Kai's after. All right, so this was after the stem cell. This was our panel recheck, and I mean, this is amazing. Uh, the our vitamin D level, he absorbed that very well. We were able to see that and kind of make adjustments. So this also is great to be able to recheck and look at these things. His TK value improved, that neoplasia index came down, that HA level, he responded so beautifully to the Regensa, the Regeniflex, I'm sorry, and the Silencia. I was very, very pleased. And from an orthopedic standpoint, I mean, Kai's doing great. So this was really positive to be able to see that we were able to make a diagnosis of degenerative joint disease, incorporate regenerative medicine, supplements, and make a really amazing impact on these labs. He's still doing well, and we're still monitoring. He did have some changes with his haptoglobin marker, but remember, he also has some immune-mediated associated diseases. And this is something that we've kind of we're still working with him with regenerative medicine options to manage his immune disease, and but he's doing very well from an orthopedic standpoint. So Kai was a success, and VDI was definitely integral in helping us to diagnose, have a treatment plan, and have success with his case. So, okay. I shared this too, only because of that inflammatory marker that increased. We did an additional cancer screening test for Kai, and he came back positive for an antigen GAD 65, and this test measures an antibody response. So this can kind of help us hone in on specific cancer diagnoses. So again, an interesting case, vitamin D and cancer. I could talk for a whole long time about that, but I do feel like having this information, knowing that not only did he have this immune disease, which end up being a lymphoma cancer process, we were able to kind of use all this information and continue to treat him to improve his disease clinically. And Kai is doing great. So I just wanted to share that additional piece with him. This is another kitty. This is a kitty that came to us, and he's young. He's kind of right at that cutoff mark for testing, and we discussed this with him. But this kitty, I believe, was originally hit by a car and was at a specialty hospital and had bilateral FHO surgery. He had fractured both of his hips. So we questioned whether or not this was a like Perthes thing, but this again was a rescue cat that was brought in. They said it was most likely hit by a car and had these injuries, had surgery. But this cat was still having some lameness issues and some mobility issues. And so, I thought, having this young cat, having already early on this history of orthopedic surgery and um, you know, orthopedic disease, that, we might want to get a baseline and just kind of look and see where Finn is, just to see if there's anything we should be doing proactively to be ahead of degenerative joint disease issues. So this was our baseline testing for Finn. And you can see that osteoarthritis marker positive again for him at 52.9. Also low levels of vitamin D, and that inflammation, that inflammatory marker is high. So, Randy kind of did a little bit of discussion on like the progression and how do you treat and what do you do at these different stages. And typically when I have a patient that has that inflammation marker and an HA, I know that we're already dealing with more advanced disease. We're dealing with um, definitely clinically more advanced disease. And the more diagnostic testing that I can do, I can prove it. But these patients are headed toward having permanent bony changes that we won't be able to undo. And so with Finn's history and with him still having mobility issues after having major orthopedic surgery, we went with the regenerative medicine option for him as well, in combination with Silencia. And he's also still currently on Trixin. And these animals, I mean, this protocol, they respond so quickly and so well. That hyaluronic acid supplementation, or even just really good joint supplementation, when we can diagnose this early on, can really just be very, very helpful. So this was another a cat. But really, the more cats you test, you're probably going to find that more of them have issues with osteoarthritis and degenerative joint disease than what we even imagine. And it's really simple, easy things that can really make a big impact and outcome. He's also scheduled for a follow-up, and excited to kind of maybe share his additional tests. But he is clinically doing very, very well after our treatment. So that was Finn. Amaya, this is another older German Shepherd that came in and has been a very active dog most of her life. The only issue was, and it wasn't obvious, but just she's not jumping up on the bed anymore. And that was it. Like, and I just want to make sure that there's no hip dysplasia. German Shepherds are a breed that are genetically predisposed to osteoarthritis, hip dysplasia, DM, that kind of thing. So this is a perfect patient to do this testing. So we did a panel on her, and you can see there she's another one that had a historically, because this is something that we screen often with a lot of patients. Historically, we had an NHA level on her, and that was at 23, which was slightly increased. And I think there was some joint supplements and things that were done early on. But at this particular test, that HA level spiked up pretty high. Now we didn't have a big jump in that CRP, which is not a bad thing. But again, those two things, that vitamin D, the role it plays in immune health and bone health, and that HA level, and that's a big jump over a couple years. I just obviously my concern with this case is that we are progressing with degenerative joint disease, and we need to intervene. So for this case, we did actually a full stem cell transplant, used Ardent Animal Health, and we processed stem cells and actually injected live stem cells, and also started the both combination of Trixin and vitamin D. So her follow-up here, I mean, and I think this is unbelievable. This is um, I I mean, just incredible. D levels had improved significantly. That inflammation marker, even though it wasn't super high, it definitely improved. That level came down even more. And wow, what a change in that HA. I mean, wow. For an owner to see something like this is exciting. It's like, wow, we fixed it, you know. And clinically, we went from a dog that couldn't jump up on the bed again, and I do have a video for the next case, which is great. But when you have a patient that has these physical limitations that suddenly they don't have anymore, and it's such a rewarding thing, and being able to have a test and a way to monitor and measure that typically doesn't just involve x-ray, looking at x-rays and saying yep, it's worse or it's still the same. It's either worse or it's still the same. When you do x-rays, it's not better generally. These are exciting. This is exciting as a veterinarian to be able to run a test, do something, and run a test and show a client not only is she doing better, but look at this. I love doing this, and I love being able to have this as a tool to show the progression of how some of these things can help. So this is Disco, and I have videos of Disco. This is a kind of a special patient. I got a call from a client. This guy lives in New York. I'm in Michigan, and he had heard about some of the regenerative medicine that I do, and he knows that I do different testing, and he just felt like I would be able to offer help for him that other vets couldn't. And again, a lot of that has to do with because we're able to screen and look for things and give clients information that they generally can't and don't get from their vets. Not that they can't, they just don't have the knowledge to run these tests and do these tests. He was 11 years old. He had a ton of lipoma masses, and he had some changes on his CBC chemistry, a slight increase in ALP. I didn't think it was horrible, but the previous vet was concerned about Cushing's disease because of that increased alkaline phosphatase. And sometimes with that increased ALP, you know, we arthritis can be a part of that. So it's not always endocrine disease. Sometimes there's some arthritis changes there. So we'll go ahead and look at his labs. I talked to him and I explained to him the importance of you know, some of these unique testing modalities. He was very interested in thermal imaging. And so we did these scans. These scans, it's literally like taking a photograph of the animal. It's very quick to do in clinic. We snap a couple pictures, and it just allows us to see abnormal heat patterns in a patient. And sometimes if you're not 100% sure where the lameness is, or if there's a specific problem area, sometimes the thermal imaging can be very, very helpful. He wanted to have it done because he thought it was cool, and he wanted to have these thermal images, so we did it. And we didn't see a whole lot with the thermal imaging with him, but so we did the VDI testing, and I did the pre-stem cell panner, one because he's older and I wanted to see TK. I wanted to get that neoplasia index. I had intentions of using a regenerative medicine option with him, and so I'm always gonna kind of lean towards having this pre-stem cell panel in those cases, just because that TK information might help guide if we have a potential underlying cancer process or something like that. And it's very important that we know that when we're considering regenerative medicine options. But we had an increased HA on him, and I want to move forward. He was at 29.6, and vitamin D wasn't bad at 98.4. I want to go move forward to see his the next slide that shows the videos. So first video here we're going to play. This is prior to doing any regenerative medicine with him, and this was prior to him coming to see us. I think he had made this video um, a week before he had come to our practice. And this dog walks every day. He lives in Manhattan. He walks with him every day. And you know, this isn't bad, but you can see that he's moving really stiff. I think this is going to loop around, and just pay attention to how ginger he was getting out of that bed and just getting moving. His tail's wagging, so he's not obviously I don't think he's suffering. He's still a happy dog, but there's definitely some discomfort here with Disco. And so, seeing that video and having him share that with me prior to this video was literally 1 week after, and we didn't use NSAIDs. We didn't use he's not on chronic long pain management or anything. We did regenerative medicine, and this was him 1 week after. I mean, that's incredible. This guy, I mean, he flew here from New York, and he said, it's miracle medicine here. And it's not. We just have really good tools, and some great options with regenerative medicine. If you saw my treatment plan with him, we did some ozone work with him. I did ozone acupuncture with him. We used that Regeniflex, the stem cell exosome therapy injection. Even though his levels weren't bad, his vitamin D levels, he's at home. He's got Trixin, and he's using that regularly and religiously. And this dog's quality of life has improved so much. So seeing just that before and after, he's going to be back. He's going to make the trip back to see us because he wants to, we want to keep an eye on that HA level. But his case, with him being older, I honestly think with Disco, he was on that up and kind of coming down. I think his HA levels were probably much higher than that at some point. And this is why, in this case, I didn't hesitate to jump to regenerative medicine. I know that when a dog has clinical symptoms of osteoarthritis, but I don't see that HA level as high as what I would expect, I'm running out of time to treat this dog, and I'm going to run out of options. So I've got to be a little bit more aggressive. And that's kind of what I did. He wanted to avoid a lot of the conventional medicines with him. He didn't want to have him on long-term NSAIDs or long-term injections. So we went with the regenerative medicine, and I used ozone and I used hyperbaric oxygen therapy. But the results here were astounding, and I'm very pleased, and he is still doing very well. And I think that we will continue to keep him active and mobile and doing what he loves to do, which is walk every day for his life, and that's our goal. So I thought that was a good case. So tried to kind of just share a variety of different cases with you. Yeah, we'll look back again. I just some final thoughts. We can go right to the final thoughts here. I know we're probably on time here. Um, HA it's an early indicator of joint disease. It can radically change how we're able to care for our veterinary patients. I was just at a Zoetis meeting, and we were talking about Librela, and one of the things the orthopedic doctor who did that lecture, she stressed the importance of screening. You need to screen. We need to screen. How do we do that? The tools that we have available to us right now are x-rays. I have things that some veterinarians don't have. I have thermal imaging. I also have a stance analyzer, so I'm able to look at how weight is distributed. And some of these things aren't very expensive, but when we're looking at x-rays and we don't see anything, but the animal still has problems, how do we screen? This is it. I mean, I think that This is a test that every veterinarian should know about and should be using regularly. What you're going to find and how you're going to be able to help your patients, they won't be able to thank you enough. And I think that this is what we're here for. We need to be proactive in regards to joint health, not reactive. If we wait for bony changes on x-ray, it's too late. We can't undo the bony changes. We can make changes when we have increased HA level and damage to that joint capsule. If we can catch these things early on and start making positive changes early on, we can truly slow down the progression of this horrible disease and extend the quality of life and quality of health of so many of our patients. Um, we can use it as a tool to assess the progression of disease or how our therapies are working. Is what we're doing working? If you have a laser in your practice, if you're doing PEMF, electromagnetic field, if you're doing physical therapy and any of these alternative modalities to help patients, and there's so much information to show that there's so many things that can help. If you're using joint supplements, this is a tool that we can use to monitor and assess, is it working? Is it helping? And can we do more? Should we do more? So just as in closing, I hope the cases were helpful to you. But more importantly, I hope that you grab a hold of someone from VDI, get access to information on how you can run this test and start doing it and start helping your patients on a level that I feel like we really haven't been able to do yet in practice. So thank you, Randy, for the opportunity. Thank you, VDI. If you have any questions, I think we're open now for that.
Yeah, I'm unmuted now. But thank you so much, Dr. Greer. That was great. I mean, that was really, really great. So yes, we have questions. Oh, we have them right here. Hang on. What factors besides degenerative joint disease might elevate HA, and how specific of a biomarker is it for degenerative joint disease? That's one question that we have here. Well, I can chime in a little bit on that, and that is that if you've got a patient that is like an agility dog, we have some agility dogs there. You don't like a marathon runner. You don't want to be drawing their blood immediately after a lot of strenuous activity, because even if you take a marathon runner and measure, you're going to see some leakage that's going to occur just from all the pounding that's going to happen. And so that's one of the things. And we do make notations of that in the report, but that is one element that I think is important. I wouldn't call it necessarily, as I indicated also, it's part of the ECM, and therefore we want to make certain that there is no tissue damaging events that are going on, growth that's going on. And as long, and we're dealing with a dog that's typically like 5 years or older, or an older cat, these things are not relevant, and therefore it's then a more direct marker for joint health. Does HA testing guide your choice or timing of regenerative therapies like stem cell or PRP? I guess I'll leave that for you.
Yes, absolutely it does. There was a case there that I presented, and in Disco, that last case, if you remember, it was an older dog. When I'm looking at patients that have increased inflammatory markers, low levels of vitamin D, and increased HA, I know that just pain management isn't enough. Pain management is going to be important, but we don't want to just put a Band-Aid on things. We want to actually try to help the patient beyond covering or reducing the symptoms. And so with those patients, there are some patients that I do feel like regenerative medicine is really going to be an important option. The vitamin D, I think, is very important to have that information. I have actually waited on patients because of vitamin D levels being low. And I believe that stem cell and regenerative therapies won't work as well in a patient that's severely vitamin D deficient. I'm working with another company to kind of do some investigative research on that to help uh, get some clarification and a better understanding, and so that regenerative medicine can be more effective for all patients and not just some. There are some patients where it doesn't seem to do as much for them, and that low level of vitamin D, I believe, plays a role. So I do use all of this information to kind of help pick which patients. And a patient that is physically obviously arthritic, but the HA level is not very high, those are patients where there's damage done. And we're almost getting to that point where it's going to be very difficult to return. And regenerative medicine is going to be something that we absolutely need to discuss. Um, I do feel like in practice and now with the use of exosome therapy, I'm using it sooner and earlier because it's cost effective now. We can do a stem cell injection that lasts almost a year for a few $100s. And that's reasonable for most people, especially when you consider how much NSAIDs and pain management can be for most patients. If you can do a single injection for a few $100s that lasts for almost a year, and have positive clinical improvement and also slow progression and actually potentially heal some of these things, that's very promising. So yes, I can say that I do use this information to kind of choose which type of regenerative medicine option is going to be the most effective for a particular patient. There's a lot of variables and definitely a case by case basis, but that's just an example.
We have one more, I think, here we have time for, and you would be most appropriate to address it.
Mhm.
How often have you seen any side effects from Trixin, such as diarrhea or vomiting? Also, do you use it in place of Adequan or in addition to?
It is not Adequan at all. I will use it in addition. I think that both of those supplements work very, very differently. And joint health is you really have to take a multimodal approach. And I feel like even with supplements, glucosamine does what it does, and there's a lot of question and um, uh, research that questions exactly what glucosamine does. But hyaluronic acid in the body, and how it works in the body and how it can help improve the synovium, help with fluid, and I believe almost help to create almost like a seal or a boundary using that MHB3 hyaluronic acid. It's very different. Um, and I do use it in addition to Adequan very often. That Adequan sort of that you're familiar, that polysulfated glycosaminoglycan, that the way it's described is it almost helps to create sort of almost like this protective pad that helps to improve the synovium and joint fluid. It sort of that molecule sort of adheres somewhat inside the joint, so it does help additionally to improve joint health, but it doesn't do what the hyaluronic acid does. And I think there is absolutely some synergy using them
Mm.
together. And so I would absolutely recommend that. I still would use glucosamine and other joint supplements as well. It kind of really depends on where we are in terms of clinical disease, and what's going to be the best to improve the outcome. One of the other things that I feel like we can't forget about is muscle atrophy, and making sure that we're using something to also um, improve muscle mass.
Mm.
We know that it happens with these orthopedic cases, but we don't always do a lot with it. So we are typically using multiple joint supplements in patients that kind of have different roles and functions, but work together beautifully and synergistically and get us the outcome that we're looking for.
All right. Well, thank you so much, Dr. Greer.
Yes.
And I want to thank everybody in attendance as we've reached the hour. And I think this is all exciting stuff. And if you have any more questions, feel free to direct them straight to VDI, and we'll be more than happy to address them appropriately.
Thank you.
And thank you all very much.
Thank you.